Hey Alpha Nurses, I'm Nurse Sandra from alphanursguy.com. This is NCLEX PN Review Lesson 24. We're going to be doing maternity nursing questions. You can follow me on Facebook, Instagram, and TikTok to get any updates. Links will be in the description. Without the way, let's get started.
Question 1. The nurse is collecting data from a pregnant client when the client asks the nurse about the purpose of the fallopian tubes. Which is the accurate response the nurse should make? A. Secrete estrogen. B. Are where the fetus develops. C. Are where fertilization occurs. D. Secrete progesterone. The correct answer is C. Are where fertilization occurs. Rationale: each fallopian tube is a hollow muscular tube that transports a mature oocyte for final maturation and fertilization. Fertilization typically occurs near the boundary between the ampulla and the isthmus of the tube. The fetus develops in the uterus. Estrogen is a hormone that is produced by the ovarian follicles, the corpus luteum, the adrenal cortex, and the placenta during pregnancy. Progesterone is a hormone that is secreted by the corpus luteum of the ovary, the adrenal glands, and the placenta during pregnancy. Question 2. The nurse working in a prenatal clinic reviews a client's chart and notes that the healthcare provider documents that the client has a gynecoid pelvis. The nurse understands that, which is a characteristic of this type of pelvis. A. Not favorable for labor. B. Not normally a female pelvis type. C. A wide pelvis with a short diameter. D. The most favorable for labor and birth. The correct answer is D. The most favorable for labor and birth. Rationale: a gynecoid pelvis is a normal female pelvis, and it is the most favorable for successful labor and birth. An android pelvis would not be favorable for labor because of the narrow pelvic planes. An anthropoid pelvis has an outlet that is adequate, with a normal or moderately narrow pubic arch. The platypelloid pelvis has a wide transverse diameter, but the anteroposterior diameter is short, thus making the outlet inadequate. Question 3. The client asks the nurse about the purpose of the placenta. The nurse plans to respond to the client, knowing which about the placenta. A. Cushions and protects the fetus. B. Maintains the body temperature of the fetus. C. Surrounds the fetus and allows for fetal movement. D. Provides an exchange of nutrients and waste products between the mother and the fetus. The correct answer is D. Provides an exchange of nutrients and waste products between the mother and the fetus. Rationale: the placenta provides an exchange of nutrients and waste products between the mother and the fetus. The amniotic fluid surrounds, cushions, and protects the fetus and allows for fetal movement. The amniotic fluid also maintains the body temperature of the fetus. Question 4. The nurse is describing the process of fetal circulation to a client during a prenatal visit. The nurse should tell the client that fetal circulation consists of which? A. 2 umbilical veins and 1 umbilical artery. B. 2 umbilical arteries and 1 umbilical vein. C. Arteries that carry oxygenated blood to the fetus. D. Veins that carry deoxygenated blood to the fetus. The correct answer is B. 2 umbilical arteries and 1 umbilical vein. Rationale: blood pumped by the fetus's heart leaves the fetus through 2 umbilical arteries. After the blood is oxygenated, it is then returned by 1 umbilical vein. Arteries carry deoxygenated blood and waste products from the fetus. Veins carry oxygenated blood and provide oxygen and nutrients to the fetus. Question 5. A nursing student is assigned to a client in labor. The nursing instructor asks the student to describe fetal circulation, specifically the ductus venosus. The instructor determines that the student understands the structure of the ductus venosus if the student states which about the ductus venosus. A. Connects the pulmonary artery to the aorta. B. Is an opening between the right and left atria. C. Connects the umbilical vein to the inferior vena cava. D. Connects the umbilical artery to the inferior vena cava. The correct answer is C. Connects the umbilical vein to the inferior vena cava. Rationale: the ductus venosus connects the umbilical vein to the inferior vena cava. The foramen ovale is a temporary opening between the right and left atria. The ductus arteriosus joins the aorta and the pulmonary artery. Question 6. During a prenatal visit, the nurse checks the fetal heart rate of a client in the third trimester of pregnancy. The nurse determines that the FHR is normal, if which heart rate is noted? A. 80 beats per minute. B. 100 beats per minute. C. 150 beats per minute. D. 180 beats per minute. The correct answer is C. 150 beats per minute. Rationale: fetal heart rate depends on gestational age. It is normally 160 to 170 beats per minute during the first trimester, but it slows with fetal growth to 110 to 160 beats per minute near or at term. Question 7. The nurse is reinforcing teaching to a pregnant woman about the physiological effects and hormone changes that occur during pregnancy. The woman asks the nurse about the purpose of estrogen. The nurse bases the response on which purpose of estrogen? A. It maintains the uterine lining for implantation. B. It stimulates the metabolism of glucose and converts glucose to fat. C. It stimulates uterine development to provide an environment for the fetus and stimulates the breasts to prepare for lactation. D. It prevents the involution of the corpus luteum and maintains the production of progesterone until the placenta is formed. The correct answer is C. It stimulates uterine development to provide an environment for the fetus and stimulates the breasts to prepare for lactation. Rationale: estrogen stimulates uterine development to provide an environment for the fetus, and it stimulates the breasts to prepare for lactation. Progesterone maintains the uterine lining for implantation and relaxes all smooth muscle. Human placental lactogen stimulates the metabolism of glucose and converts the glucose to fat. Human chorionic gonadotropin prevents the involution of the corpus luteum and maintains the production of progesterone until the placenta is formed. Question 8. The client arrives at the prenatal clinic for her first prenatal assessment. The client tells the nurse that the first day of her last menstrual period was October 20, 2021. Using Nagel's rule, the nurse determines the estimated date of birth is which? A. July 12, 2022. B. July 27, 2022. C. August 12, 2022. D. August 27, 2022. The correct answer is B. July 27, 2022. Rationale: the accurate use of Nagel's rule requires that the woman have a regular 28-day menstrual cycle. Subtract 3 months from the first day of the last menstrual period, add 7 days, and then adjust the year as appropriate. In this case, the first day of the LMP was October 20, 2021. When you subtract 3 months, you get July 20, 2021. If you add 7 days, you get July 27, 2021. Add 1 year to this, and you get the estimated date of birth of July 27, 2022. Question 9. A pregnant client asks the nurse in the clinic when she will be able to start feeling the fetus move. The nurse responds by telling the mother that fetal movements will be noted between which weeks of gestation? A. Between 6 and 8 weeks gestation. B. Between 8 and 10 weeks gestation. C. Between 10 and 12 weeks gestation. D. Between 16 and 20 weeks gestation. The correct answer is D. Between 16 and 20 weeks gestation. Rationale: quickening is fetal movement that usually first occurs between 16 and 20 weeks gestation. The expectant mother first notices subtle fetal movements during this time, and these gradually increase in intensity. Options A, B, and C are incorrect. These gestational time frames are too early for quickening. Question 10. The nurse is collecting data from a client who is pregnant with twins. The client has a healthy 5-year-old child who was delivered at 38 weeks, and she tells the nurse that she does not have a history of any type of abortion or fetal demise. The nurse should document the GTPAL for this client as which? A. G equals 3, T equals 2, P equals 0, A equals 0, L equals 1. B. G equals 2, T equals 1, P equals 0, A equals 0, L equals 1. C. G equals 1, T equals 1, P equals 1, A equals 0, L equals 1. D. G equals 2, T equals 0, P equals 0, A equals 0, L equals 1. The correct answer is B. G equals 2, T equals 1, P equals 0, A equals 0, L equals 1. Rationale: pregnancy outcomes can be described with the GTPAL acronym. G equals gravidity, number of pregnancies, T equals term births, number born after 37 weeks, P equals preterm births, number born before 37 weeks gestation, A equals abortion/miscarriages, number of abortion/miscarriages, L equals live births, number of live births or living children. Therefore, a woman who is pregnant with twins, and who already has a child, has a gravida of 2. Because the child was delivered at 38 weeks, the number of preterm births is 0, and the number of term births is 1. The number of abortions is 0, and the number of live births is 1.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.